Now, it can often feel like there's a bit of disconnect between Westminster and what's actually going on in people's lives around the country. So each week on the programme, we're trying to speak to people from across the United Kingdom and really talk about the challenges that they're facing, be it on the cost of living, an energy crisis, or the NHS, perhaps housing, crime, and more as well too. Now, here in Liverpool, we are trying to look a bit at the NHS. We were speaking about it earlier in the programme, but just 10 days ago, bosses at the Royal Liverpool Hospital issued a full capacity warning staff in a letter that there was no space in resuscitation areas. And we can speak now to NHS staff nurse Mark Anthony and hear his story. Thank you very much for being with us. It's good to have you on the programme today. I mean, look, we see the statistics on the NHS, waiting times, ambulance delays, postponed appointments. But I guess I'm interested to hear the human side. What is it like to work in the NHS at the minute?
It's absolutely terrible for staff working in the NHS at the moment. We're chronically understaffed. Staff cannot even give the basic care for patients. Sometimes you get staff getting in trouble because they've not been able to give medication on time, or to end up getting some performance plans or disciplines, and it's not their fault at all. This is the fault of the government. The government has let the nursing down terribly over the past 10 years. We're vastly underpaid, and the staffing is absolutely so bad now that I fear for patient safety. I really do, and I think that unless we have no choice now as the Royal College of Nursing to ballot for strike action. We're not doing this for our own selfish aims or anything like that. We're grossly underpaid. Nurses are leaving in their droves. 20,000 left this year, and now we end up in a situation where patients are so much at risk now that we have to do things like this. This government is not listening, and it never was going to listen. And but we've tried very, very hard to negotiate, and we're not getting anywhere.
I wanted to hear a bit about what it's like on the actual wards. You know, you were talking there about the pressure that nurses are under, patient safety being put at risk. What kind of thing do you mean? Is it like people have been given the wrong medication because there's a rush, or what is it like?
What it is that the wards are so understaffed that you can actually get situations where sometimes patients at times maybe not given the medication in time. Sometimes there are situations where the patients are put at risk because they could have health and safety issues like falls and things like that on the wards. There's also situations where just the basic care, sometimes you get some patients, unfortunately, which is tragic to say this, that sometimes can be sat in faeces and nurses can't get to them in times where they'd already try to, and in just the basic care of even just trying to give them food and things like that. It's getting so bad now that we're in I've never known it as bad as this, because I've been nursing 35 years, and now I know it's now from the stories that I hear from my colleagues, I think that this is just a dire situation, and it's only going to get worse.
And you've been a nurse for 35 years, so you're still a nurse. You're also a member of the Royal College of Nursing Union. Is this the worst that you've ever seen it?
It is definitely the worst I've ever seen it. And the real tragedy that what's happening now, this is actually becoming the norm. If this carries on, with what's happening, the NHS is just going to lose its value as to what it used to be. I mean, I'm proud to be a nurse. I'm proud to. I joined it as a vocation. I joined it to represent, to want to care for people. And now it's not coming that way. You just come on the shifts. You're totally stressed out. You're up to, and you know that it's going to be a really hard shift. They're moving staff from one ward to the other, from one hospital to the other. It's like shuffling the pack because of the situation. The staffing levels towards the number of patients, it can be drastic. Sometimes you get 2 staff and you get 20 odd to 30 patients on a ward, and that is just not good enough. It's absolutely dangerous. And something has to be done. And if they don't pay nurses the proper pay that they should be getting, and remember, we've been taking a pay cut over the past 10 years, and we're constantly trying to battle for this, because if you don't pay nurses the proper pay, the nurses are going to continue to leave the service, not wanting to do that. They have no choice. We didn't join nursing to be dirt poor. We joined nursing to want to take care of patients, to want to be responsible for doing that, and we love our job. But now we're pushed so much now that we have no choice now but to come out fighting.
OK, thank you very much indeed.